Today we'll be discussing about the center venous catheter. So let's dive into the topic. Center venous catheter. So CVC is a tube placed in the large central vein near the heart to deliver or withdraw the fluid. I'll be attaching the picture right in the center. You can see that. And it is used to avoid repeated needle sticks, give the medications, especially IV drugs, draw the blood samples, administer chemotherapy, provide the total parenteral nutrition (TPN), and deliver the continuous IV therapy. And where it located, I'll put the picture and you'll know that. And usually it is inserted on the right clavicle, and the tip site is on the large center vein near the heart. And let's go to like key part is exit side where it comes out of the skin, right? We have to take care of that part, being as a nurse. Like the clamping the catheter must be clamped when not in use, because we don't want the ear or the blood to drain from the line, so you have to clamp it. And also clamp during the cap changes, leak or tubing damage. And safety rule. Protect the tubing with the foam before clamping, and they rotate the clamp position to prevent the damage. Keep a backup clamp nearby at all times. If some clamps is malfunctioning, you can get back that new clamp, and you have to clamp the line when you are not using that. And for the dressing chains, like the dressing site care or the port site care, for the infection prevention is our main priority, because like it is, the line will be on the outside of our above our on our chest, right? And when you are not taking care of that part, it might get infected and it might damage the line. So infection prevention is your priority, and always perform hand hygiene first. Inspect for redness, swelling, drainage, and tenderness when you are doing the dressing, and you have to record that on your narratives as well. And cleaning techniques should be clean from the exit side. Exit side is the where the site is started to come out, like it's towards outward in the circle. You have to do the outward, and it should be ended on the cap area. Never go back to the center with the same swab. Apply the ointment dressing if ordered. Secure the tubing with the loop and the tape. And catheter cap change. Follow the strict aseptic technique when you are opening the cap of the center lines. Change as per the hospital or the hospital or physician order, how they wants to do it, like the proper way. And avoid the contamination at all cost. And complication and emergency action, what you have to do in the when you got these complications while doing the like when the patient had the catheter, like the central catheter, or you are doing the dressing on it. So ear emboli, for the emboli emergency, signs will be shortness of breath, chest pain, cyanosis, coughing, okay? And the action will be the clamp catheter immediately. Place the patient in left side and call the emergency help. And for the infection, sign will be redness at the site, drainage, fever, and sweating. And action will be notify the nurse or the physician immediately. And catheter, if the catheter break, sign will be visible tubing damage, and you should clamp above the break, close to the body, so that the ear won't be passing through the breakage, and they report it immediately. And for the hemorrhage, like the large blood loss from the catheter, you have to clamp the catheter immediately. Call emergency service. You have to think on that mind, like if the line is open, then you are ending that patient with various disease condition, like the infections, they will be having ear emboli and everything. So your mind should be like, I should clamp the line so that the further issues won't be arise. And the clotted catheter signs will be resistance during the flossing or infusions, and the actions will be never force floss. You should not be forcing the floss when it is unable to, when you are unable to push that fluid, okay? And you have to notify your physician or the nurse who is competent enough to handle those. And for the sepsis, life-threatening signs will be fever, chills, low blood pressures, confusion, or altered mental status. So if the patient is having fever, chills, like that means the infection, he is getting infection. So you have to be cautious about, like, okay, he might get sepsis. So, and if his blood pressure is low, you need to consider that he might get the sepsis, right? And for even the confusion and altered mental status, like a patient, when they usually the old people, when they start having the infection, they get confusions, even for the UTI as well. And for the action, you have to notify the physician immediately and follow the protocol as mentioned in the hospital, or the physicians, they will provide the protocol that we have to follow on those emergency. And let's see, we have talked about the ear emboli, right? And ear emboli, I think, let me double check, I think that's all. Infection, hemorrhage, sepsis, right? And those are the main complications, or the future emergency that arise after having the central venous catheter. So I think that's all for this. I have prepared the materials, those materials, so that you can test the patient as well, and you can know what you have to do on those emergency. That's all for today. Thank you, and see you on next video. Bye bye.